Okay, so within this, okay.
Turned on, or did it go to sleep?
I think it did not. I think it went to.
The remote's there, the white remote right there.
Okay, thanks. It's a good question. You can't. Can you see if it's?
Looks like the power is on.
It is on, but there's no light emitting from its front. Okay, so we have heat but no light. Okay. Is it blinking?
Yep.
Okay. So that
There we go. It's on
be the nail that brings us to heaven or to hell. Okay. Great. Okay. Let there be light. Okay. Great. Shakespeare and Milton, 2 sentences. Not bad. Okay. So we're going to be hitting on some concrete sort of explication of 2 of the dynamic modeling approaches talked about earlier. Okay. And I've covered this material in different subsets before. We're going to be focusing, because of time, because we're ending at 12, but we need to cover more material well before that. We're going to be doing system dynamics and agent-based modeling here. Social network analysis, again, Elizabeth indicated we'll talk, particularly in the ABM context, about how that articulates some with agent-based models, because there are powerful ways in which social network analysis can be used with agent-based models. And once again, I do teach a little bit of that, and if there were interest from people in understanding in greater depth, you pull me aside and we can talk in more detail. And I will not be commenting about discrete event modeling, but it will come up a little bit here and there in the course, particularly with regards to health service delivery as a technique for hybrid modeling. Okay? Okay. So system dynamics, agent-based modeling. We're going to see each of these techniques in much greater detail. And the goal here is to just give a flavor and a glimpse of them. Okay? So system dynamics is a technique that was first formulated in the late 50s, goes back to 1958 with the work of the towering pioneer of the field, J. Forrester. Jay was a prolific contributor in his engineering capacity at MIT. He was in my sort of alma mater school, the School of Electrical Engineering, and before it even became electrical engineering and computer science at MIT. And he was a huge pioneer that revolutionized control theory, and so theory of control by which rockets and unfortunately missiles and but positively planes are flown. And he was also someone who invented whole new types of ways computers could store memory, something called core memory, magnetic core memory. Jay in the late 1950s got really interested in ways in which techniques and insights from those areas could be applied to organizational systems and to describing systems in the world more generally, so that we could better control those systems. He had particular interest in industrial organizations and farms, etc. So this is back in the 1950s, and the technique really got codified in the 60s and 70s, and there's actually a very interesting historical period where it got into some high-profile sort of headbutting with economists, particularly with respect to economic-related models, which, in my view, shaped the field because of early trauma in ways that are still visible. But system dynamics basically brings a feedback-oriented perspective and understanding problems. It focuses on feedback, cases where a change ripples around and amplifies or pushes back against the original change. For example, I get hungry. That hunger motivates me to go eat. That lessens my hunger. That's what we call balancing feedback. It limits that the actions I take as a result push back against the original change. There can be feedbacks that are, by contrast, reinforcing. So I develop an addiction to nicotine. It drives me to more use of cigarettes. It worsens my nicotine addiction. We talk about vicious cycles. As we'll see this afternoon, there's one positive with gestational and type 2 diabetes, for example. Those are feedback processes. It also focuses on accumulation processes, processes by which things accumulate and sort of decay over time. Accumulation of people, for example, in a state with diabetic end-stage renal disease, with flow in from diabetes and flow out due to death or transplant. But system dynamics, in addition to bringing this perspective on looking for feedbacks and accumulations and characterizing them, it's a broad evolving methodology. And I emphasize evolving because it is evolving, that basically helps conceptualize complex systems, describe them in a very visual way. And this is absolutely central to its goals. It's not merely an accident that system dynamics has a very visually compelling depiction. It is central to its goals to communicate with stakeholders. To analyze those complex systems, system dynamics has a rich mathematical foundation of what are called ordinary differential equations underneath it that allow for formal reasoning about it, and that's often very powerful. It can allow for very powerful insights, and to manage these systems, okay? So system dynamics, it's very important to emphasize to students. It offers qualitative and quantitative components. This is not purely a system for numerical grinding out of results, nor is it purely a system on the qualitative side. It has rich components of both, and it has focused more than any other methodology I know very consciously on how do we, as a community, and in the human theater, how do we go about building models so that they offer value? They offer value to stakeholders from the get-go, and they offer that modeling process offers values to stakeholders from the get-go and all through the process. How do we engage stakeholders as embedded people within this process of building a model? So it's not, the uber geek like me sitting in a back office, in a proverbial darkened closet and developing the model and then gifting it to you, say, here is your answer. But instead it's you being embedded within the process and interacting with the model and giving feedback on it, etc. It has time-honed techniques for participatory work with diverse stakeholders in light of this, for bringing stakeholders into the process and using them to shape the model. It was into participatory action sort of work before that term became hot and patient-oriented research was, all the rage. It does at the same time have a rigorous mathematical foundation. It's amenable to really rigorous reasoning and a set of analysis approaches that allows us to do some very powerful things, including combining it with machine learning algorithms. And much of our work these days includes building system dynamics models that when new data comes in from our emergency rooms or when it comes in new case reports from an outbreak of measles in Alberta, we can integrate it with that model and get the model's latest estimates for what's going to happen over the next few weeks, etc. And it's very evolved software that visually allows us to interact with the model and really focuses on us on what is being described rather than the details of how it's simulated. It's basically designed to allow modelers to step back from how this is captured, to get a programmer out of the loop, basically, and allow us to focus on what are we characterizing. That's a lot of its goal. I happen to be involved in a project with that same goal, bring that same goal to agent-based and hybrid modeling more generally. But system dynamics has long done this from the 70s. And it was a contentious thing when it was introduced because people were saying, but untrained people will start to do modeling. And there was a whole community discussion about whether this is good, and et cetera. Okay, so a central theme of system dynamics. Ladies and gentlemen, when we look at these modeling approaches, it's very easy to get caught up in and the particulars of how they describe the situation, the building blocks that we use to describe it. And there are some interesting differences you'll see between them. Stocks and flows, system dynamics, and over on the agent-based modeling side, we have a very different set of ways of describing behavior. But what I want to highlight is that the most fundamental traditional difference that has divided these disciplines is one that practitioners in each discipline often misunderstand about the other. Particularly a lot of agent-based modelers don't get this about system dynamics. System dynamics as a field generally seeks to focus on changing how people think about a system. It's not about the model delivered as an artifact, here's your model. It's about how are people thinking about the system, how are the stakeholders understanding the system. And that shapes a lot of how things are done in system dynamics. And a lot of the cases where you find people from agent-based modeling and system dynamics not really communicating is because I think from each community there's a failure to appreciate the goals of the other community. That the goals are different, not merely the formalisms. And so each reads the other as trying to achieve the same goals but with the wrong methods. And really the deal is often they're trying to achieve different goals. So the idea here is most decisions are based on mental models. And frequently the failure to account for policy resistance and the fact that we lead to blowback to our policies are due to overly narrow mental models, and system dynamics seeks to broaden how people think about the system. Okay, so it's very much this sort of picture from a system dynamics perspective, and then this is indeed a system dynamics semi-quantitative model. It's called the causal loop diagram. So system dynamics focuses on feedbacks as fundamental shapers, accumulators as causes for delay, inertia, disequilibrium, situations where the system's changing for a while over time, and the study of cognitive limits that leave us vulnerable to our failure to think clearly about systems. It focuses on stakeholder participation in the modeling process and models that admit to formal reasoning. And it's applied critically, and we'll see this throughout the course, at diverse levels of granularity. So we'll see in system dynamics, and if there were time, I might be able to show some examples, but I want to allocate a bunch of time for the student intros prior to lunch here. We'll see qualitative models coming out of it, models that are predominantly thought pieces to sort of capture from a room full of stakeholders who have never seen system dynamics before. Bring them together into a room. These could be high school students. These could be people from a church in inner city St. Louis, like Peter Hoffman does. These could be villagers in rural India. Come together and they build up a qualitative system dynamics model. Sounds outlandish? It is, but system dynamics has been used many times in this form, in the form of its qualitative form, what are called causal loop diagrams. And they're very powerful ways of thinking about a system. But at the same time, you'll see it very widely used for aggregate population level models. The most well-known of these models include the work on PRISM, the CDC model on diabetes, and a similar model in New Zealand, as well as some work we did in Canada. These are larger models of a population in terms of stocks and flows, characterizing the population into different subgroups, stratified, say, by age and by sex, simulating the evolution over time. At the same time, we do a tremendous amount of work with system dynamics, using system dynamics to characterize dynamics within an individual. Dynamics of addiction, or dynamics associated with perception, dynamics associated with my level of beta cell function and insulin resistance, and potentially my level of blood glucose and insulin in my blood at this time. So individual level models of system dynamics are popular within certain spheres, and particularly for hybrid modeling. And it can be used in a stochastic way as well. Big dialogue, or participatory dialogue is a big goal here. capturing qualitative understanding, and allowing specification that doesn't require a programmer, but can be understood by a stakeholder and therefore used to elicit tacit knowledge and understanding. And the goal here, again, for so much of system dynamics is to support stakeholder understanding, involvement, feedback, etc. So within system dynamics, we make uses of two primary mechanisms for specifying a model. One is what's called a causal loop diagram. Now, a causal loop diagram basically involves variables which have a polarity associated with them. We should have a notion there's more of it and less of it. So caregiver distress, for example, there can be more caregiver distress or less. And infant distress, more or less. And then we put links from one variable to another, and those links are directional. They go from A to B, indicating that a change in A can causally bring about a change in B. That we posit there's a causal connection there. And we attach a polarity to that connection. A plus would mean that if we have an increase in A, it will lead to an increase in B compared to the value B would have otherwise had, all other things being equal. If nothing else changes, it will tend to increase B relative to the value it would have had. Doesn't necessarily mean B will go up over time. It just means it'll be higher than it would have been otherwise. And we can construct a diagram which will involve these connections. And one of the things you see here is that we can have pathways of these connections that can form loops. This is, in fact, a causal loop. It is, in fact, what's called a reinforcing loop. So it tends to be behavior that has a so-called positive feedback, not in a normative sense, but in the sense that a change in caregiver distress can ripple through to the infant. So think about a mother suffering from postpartum depression. It brings on infant crying, especially, and that worsens her feelings of inadequacy, and it worsens her sense of distress. So this can be a positive feedback, not in the sense that it's a good thing, but in the sense that it's reinforcing. That original change leads to changes which make it even worse, or which further it. At the same time, there can be negative feedbacks. Infant self-regulation kicks in. So an infant feels distress, it engages in thumb sucking, and that lessens its feeling of distress. So that we have these regulatory mechanisms. I mentioned them earlier, right? I feel hunger, I go eat. I feel thirsty, I go drink. My salt is out of balance. My body has ways of excreting salt. And it turns out that in general, we can piece together systems that are composed of these. And so generally, we're not dealing with one loop in isolation. We're dealing with a set of loops. And I don't have time to go into it now. We'll have a whole day on system dynamics. But these loops interact, and they interact with each other to sort of balance each other. And we build up systems like this using these diagrams. And these are the types of diagrams that are built collectively in group model building at the most basic level. So bring together communities, people with no previous exposure. In a few minutes, you can explain this to them, and they can get going and contributing to diagrams like this. One of the amazing things about this is it brings out voices that otherwise would have gone unnoticed. Peter Hoffman has a story about how he brought this technique to rural India, looking at effects of ecosystem damage and so on, and its impact on the livelihood of villagers. And the committee that they were working with was an entirely male committee. It was a committee of something like 8 men in the committee who were sort of the village head council or something. And they were building this diagram, and they had a diagram up on the board that was quite articulated, probably about this size. I've seen pictures of it. And at one point, one of the wives of those members of the committee walked in. She was looking for her husband. She heard he was over there with the foreigner doing some weird thing in the room. And she went over and she started talking with them. I'm sorry, she came in and she didn't want to interrupt. She sat at the back of the room and she kind of looked at what they were doing and looked at the diagram And after a few minutes, she walked up and she said, wait a minute, you're missing something really important here. You've forgotten the link between this and this. And you need to modify the diagram to reflect that. And they said, yeah, that's right. Actually, we did forget that. We need to put that in. So she was able to contribute to that discussion without, a PhD, without formal training in this. And that's part of the power of this method. In addition to this, though, we build up models that are quantitative and that are amenable to simulation through what are called stocks and flows. And stocks represent accumulations, flows represent changes to those accumulations over time, and stocks describe the current state of the system, the amount of stress currently being experienced, the blood pressure of the person, the level of allostatic load that's been built up by toxic stress over time, and then there's changes to that stress in the form of what are called flows. So there's activities, for example, involving blood pressure, regulation or toxic stress that contributes to allostatic load, etc. And here stocks determine flows. Stocks determine how things are going to change in the next little bit. The current state of the system, if there's nobody susceptible to the infection, nobody's going to get infected in the next little bit. If there's lots and lots of people who are pre-diabetic, there's going to be a larger number of people developing diabetes in the next little bit. Flows dictate how the stocks will change over in the next little time unit. And it turns out there's formal analysis, and we do a lot of work which builds system dynamics models that are rough and ready, say models based on an emerging outbreak where we don't know the parameters, and based on incoming data, they correct the state of the system. These are based on what are called particle filtering. It's a more advanced technique known as particle MCMC. We're interested in Hamiltonian Monte Carlo methods forming this as well. So system dynamics, some notable strengths. Captures dynamics of continuous variables. You'll notice that all of these are continuous quantities. I have more stress or less stress. I have higher allostatic load that's been built up or less. My blood pressure is higher, it's lower. Those are continuous variables, eh? It captures dynamics, in particular regulatory dynamics that lead it to change, to rise and fall in a way that's sort of self-regulated. So, I might have certain dynamics associated with changes in my blood glucose, for example, and my blood glucose being high ends up damaging my beta cell activity, and there's this sort of set of feedbacks involved there. Or it may be at a public health level in terms of the spread of an infection. But it's this dynamics in terms of continuous quantities, the number of people infected now and the number of people recovered. It allows for very quick model prototyping. You can get, and without any programming background, you can sketch out a model very quickly. And it supports participatory modeling. Not only is it well supported by the tools, it is well supported by a codified literature, how to do it well. A whole encyclopedia of scripts that have been known to work with large groups for eliciting knowledge from those groups, etc. It basically focuses on what you need your modeling and less on the how, and so it doesn't require as much in the way of computational skills. And via formal analysis, you can do amazing things, and you can combine it very readily with machine learning algorithms these ways to bring in data from whole new sources. For example, we bring in data from search behavior, from online search behavior on a day-to-day basis to sort of shape our model's estimates as to how many people are in different states. You can do the similar thing for social media feeds, etc. And it supports intuition building among modelers, okay? Just going through this quickly, agent-based models. Agent-based models have a depiction of systems that is equally rich, extremely powerful, and I would argue even more flexible. It provides a way that is focused on agents as actors and interactions between agents as they shape the system. So rather than focusing on stocks and flows, these accumulations and the interactions between them and the feedbacks, agent-based models are focusing on the individuals and their interactions with each other as driving behaviors observed for the whole system. So we have one or more populations, and each agent, and each of these populations are characterized as composed of actors, of agents. Each of those agents is associated with some characteristics in the form of parameters and some state that's evolving over time. So the parameters might be things like their gender or ethnicity, but it could also involve continuous quantities like their birth weight or their income right now. State is things about them that are changing, their age, their smoking status, their preferences, their networks, etc. And there's actions by which they might interact with other people and things that will change their state over time, okay? And you're going to hear on tomorrow, the Parte framework, which provides a structured way of thinking about this that's a very useful context. And critically, it also involves interaction with the environment, an environment that may be social and with networks, or it may be geographic, for example. There's a time horizon and characteristics of the time horizon. In some packages, agent-based modeling is carried out in discrete time with sort of defined ticks, each of which might represent a week or a day or a month, for example. Other times it's sort of more abstract than that. And other times, for example, in any logic, it's carried out in continuous time. But there's some time horizon, some length, and often some characteristics like the units by which it's measured or the steps. And there's some initial state of the system. Okay, this didn't come out well in the PDF rendering. Suffice it to say that in agent-based modeling, we are focused on characterizing, dividing up the population. We characterize the population as divided up according to their current characteristics and state. We characterize the population as divided into susceptible people, infected people, and recovered people, for example. Those we keep track of, and we count the number of people in each category. So the data is the number that are in each category, and we divide the population. We organize the model by characteristics, their state, and their characteristics like their sex, ethnicity. In agent-based modeling, we organize the model by individual, and the data that's kept track of on each individual is their state and characteristics. So it's kind of flip it on its head. System dynamics, organize it by characteristics, and then we keep track of the number who have each of those characteristics. Agent-based model, we organize it by individual, and what we keep track of for each of those units of organization, each of those individuals is their state. Okay, so we'll have the model population. Each of these might be a person, right? And each of them might be associated with parameters, ethnicity, sex, and income, for example. Each of those, this is the model. And in the simulation, we'll have each of those people having a particular ethnicity, a particular sex, a particular income. So this is kind of our theory of personhood, says that people have a certain ethnicity, sex, and income, and because of that theory of personhood, a particular person has particular values for each of those characteristics. Importantly, we can keep track of continuous quantities on the part of an individual, what their birth weight was, or what their current blood pressure is, or what have you. A very powerful thing. It's hard to do in a model at the aggregate level using system dynamics. Each of those individuals is also associated with state, right? Their stress levels, their capacity to self-regulate, their age, and their ability to co-regulate their toxic stress. In some packages, in system dynamics, in any logic, and in now as well repass to a degree, we'll use state charts to characterize. So this is a person who's either in a not pregnant state or a pregnant state, for example. We'll say the theory of personhood accounts for the fact that people can be pregnant or not, and there can be some transitions between stuff. So this characterizes possible states they can be in and actions that can change those states and rules associated with those actions as indicated by these icons, which we could dive into. That same person might have those possibilities with respect to pregnancy, but then with respect to a different concern, their infection status, they might be divided into a susceptible category and exposed, infected, and recovered. And over time, that individual, that person there in the population might evolve, say, from this state to this state and go to an effective state and eventually recover, and they will be changing. So within a given context, we might have a person characterized by several concerns, with respect to infection status and with respect to care-seeking attitude, whether they're likely to seek care. This might occur in a trust situation, say an HIV-infected individual who's concerned about vulnerabilities in terms of care-seeking in a developing country and stigma. In addition to this dynamics with an individual, will have means of interaction with their environment. In this case, it's networks. We'll place them in a network. And we may place them in a geographic context as well. This from a simulation of chronic wasting disease in Saskatchewan among the mule deer. And so here, there's these prions shed by the mule deer building up over time. The mule deer interact with each other. Some become carcasses, which further shed prions. They wander over the environment, seek out water, seek out forage, and drop prions. Other agents take them up, and it leads to dynamics and overall agent behavior. Ladies and gentlemen, in an agent-based model, these individual agents interact with each other and evolve on their own, but we can still compute quantities at a population level from that. We're not limited to an individual level of description. We can create aggregate quantities just like we do epidemiologically by totaling up responses from many, many individuals. We can ask what's the prevalence of this infection in the population or the prevalence of this condition. And we can see spatial dynamics that are often quite interesting, quite surprising as emerging from very simple rules. From rules that in no way presuppose a certain pattern, but give rise to it as a logical consequence because of nonlinearity. They give rise to very interesting phenomena. Just trying to finish this up here. We can place individuals here in terms of networks and allow them to evolve over time. And in contrast to system dynamics models, which are most commonly, but not exclusively, formulated in what's called the deterministic way, meaning what happens in the next little bit is completely determined by the situation now. There's no chance about it. ABMs are typically stochastic. This has advantages. It allows us to reason about chance events in the world and the variability we might expect from the system to see if a model can account for the sort of variability we see in the actual empirical data. But it has consequences too. It means to secure results about which we're confident, that are robust, to make sure that our thinking is not merely reflective of a fluke we happen to have seen. We have to run a model many times over what's called a Monte Carlo ensemble. Okay. We run many realizations. We run it again and again and again and total up consequences. And the stochastics, by and large, are an asset here, but they do have big consequences on runtime. So for a given run of a model, we might get a very particular output at the end of the model with respect to the number of cases that have occurred among low SES population and among high SES population. And over time, we might have seen a number of cases over time in the low SES versus the high SES population like this. If we run the model many, many times, varying nothing other than the happenstance, the random events, the stochastics. Now we see distributions. Instead of just one result, we'll see, as we run it many times, we'll get slightly different results. But you'll notice there's certain regularities here. The low SES people tend to be afflicted by a much higher burden in terms of the number of cases than the high SES. And there's differences of degree from different run to run, but similarity. And if we look at behavior over time, we'll create these sort of 2D histograms here. So we'll see some more about this. And we can ask intervention questions. If we have a baseline scenario for both system dynamics model and agent-based, we'll often say, okay, well, if baseline scenario is kind of a reference scenario. It may not be privileged, but it's the point of reference. Often it's status quo, but not always. And then we'll ask, what if? What if we were to change this? What if we were to put in place a policy which eliminated barriers to access to clean needles, for example, or what have you. How might that change the outcomes? And run that as a scenario and see how it's affected things. Okay? Whirlwind tour. I apologize for the infliction upon you. I think there's a high burden of toxic questions here, I'm sure. But I think we do have to get on to the question to the introductions.
We
Sorry.
should definitely get to the introductions, and then
Great.
if we have time, we can. I think that. Well, let's focus on introduction first, and I should say,
Great.
by design, we throw a lot. I know this is like you're like, oh my God, 3 hours of lecture. It's not going to be like this every morning, okay? Tomorrow morning and Wednesday morning, we have lots of fun hands-on applications for you. But given the limited time that we have together, part of what we're doing is trying to throw all this information at you so that you can wrestle with it this afternoon. And I promise you, if you're just sitting here feeling like, A, I'm having trouble focusing because it's been a long time, but B, it's just there's so much it's hard to know even what to ask. Part of it is that when you start to wrestle with it, we'll go back and it will start to become more clear. So this is an iterative process. But we've been doing a lot of talking to you guys, so we would love to hear more about who you are and also what you're hoping to get out of this, because that helps us not only in our teaching but also in our group formation. So if you don't mind, what might be the best way to go is to start over here and go around and say your name,